Hello, and welcome to this section of the rapid response presentation on your health insurance options. My name is Adam Van Spinkeren. I'm the Navigator Program Manager with Covering Wisconsin, which means I have the pleasure and privilege of leading an amazing team of health insurance experts called Navigators who can provide free help anytime to help you understand your health insurance options. They'll answer your health insurance questions. Honestly, no question is too small or too big. We shouldn't expect people to understand health insurance. It's incredibly complicated, and we're not really taught it in school, are we? So that's the reason navigators exist. And we have all of this training at the state and federal levels to help you both understand your health insurance, answer your questions, and use your health insurance. So not just knowing what it is, but actually how to go about using it. But especially even before all that, helping you find and understand plans and sign up for them and get financial help if financial help is available. So you can get help paying for things like premiums and looking at the different programs that we have here. We've got healthcare.gov, which you may have also heard as the ACA, so the Affordable Care Act. It's also Obamacare, or a lot of times we just call it the marketplace because that's where you can go to get private health insurance, but with financial assistance. We also help people sign up for Badger Plus or Medicaid. So Badger Plus being Wisconsin's Medicaid program. We're experts in all of these, and Medicaid has a number of different programs we can help you look at. After a big layoff event, you may find that you have lost your income and you may need help with billing problems, or as you lose your health insurance coverage or transition out of one plan and into another one, you may find some challenges there. Navigators can help you figure all of those things out, answer those questions, and hopefully get you some help if you find yourself in financial straits because of inability to pay, things like that. And we can also help find community programs to pay for things like insurance or medical care, maybe prescription assistance. That's a big one that people need. And we are here to help. Our help is always free as navigators. And we'll look at a couple of the other types of enrollment assistance there are now, and also just what makes us a little bit different. So you may have heard some of these terms before, but you may not have. This may be the first time you've ever heard the word navigator, and that's totally okay. That's actually good. That means you're the people we need to reach. We need to reach more often. There are a couple other types of assisters, what we call enrollment assisters out there. Certified application counselors receive very similar training to navigators, and they really know their stuff. They've been doing this work as long as we have, but the difference is they tend to not do the education and the outreach piece. So presentations like this one, and they tend to be centered at hospitals and providers, clinics, things like that. So whereas you can reach out to a navigator program like ours and say, hey, I need help. Certified application counselors tend to be, hey, I've gone to the hospital or the clinic and they identified that I lost my coverage or I'm losing my coverage or I need help signing up, and they can help you then and there. And again, those people, they really know their stuff. Agents and brokers, the third one on our list here, they also really know their stuff, and you may have an agent or a broker that you or your family works with, and there are a lot of really reputable agents. You do just need to be a little bit more careful with agents and brokers because they do get commissions from health plans, and there are some bad actors out there. We'll talk about how to spot those bad actors a little bit later in the presentation, and how to protect yourself, your family, your finances, etc. The main thing to understand is that health insurance help should always be free. So answering your questions, signing up, you should never see anything like a maintenance fee, anything like that. The health insurance might not always be free because private insurance does cost money, and yes, we'll talk about financial assistance and how to get help with that. But the help itself should always be free, and that's what navigators are here for. Now, this goes without saying, right? Health insurance is incredibly complicated. It can be difficult to understand. It can be difficult to use. And that means people don't know their options. They don't know what option is best for them. They don't know what choices they even have in front of them. And honestly, it can result in spending a lot more money for your health insurance and for your health care when you actually go to use it. And that's what we want to avoid, right? Navigators, we're here. We want to prevent those misunderstandings. We want to educate, and we want to make sure everybody is in the best program or plan for themselves and their families. So what do I qualify for? Obviously, the broad answer is going to be it depends, but that hopefully is not a discouraging answer because navigators are here to kind of help you figure out what that could be. So broadly, you just need to know that everybody's options are different, right? There's going to be some major factors that determine what you're going to be eligible for, what you should do next, right? If you're losing health insurance from your job, maybe you're 65 or older and you should be looking at Medicare. Knowing that navigators don't do Medicare, even if you contacted us, we could help you find a reputable agency, an aging disability resource center, maybe who could help you with Medicare. We tend to focus on BadgerCare Plus and healthcare.gov. So if you look at your screen here, you'll see one of our fact sheets. All of our fact sheets are consumer tested. They are, at the easiest possible reading level for people to understand one of the most complicated things you're going to have to deal with, right? So we make sure that all of these things get in front of your average Joes and Janes, and people can understand all of these concepts to the best of their ability before we release these out in the wild. So you can find fact sheets like this on our website using that link at the bottom there, coveringwi.org. That's our website, coveringwisconsin/learn. And we have all of these fact sheets to help you understand your health insurance options, so whether it's broadly this one here, or more in depth on how to use your coverage, like through maybe it's your first time on Medicaid or BadgerCare, and you want to understand what that covers, or all these different ways of looking at marketplace coverage, so healthcare.gov. But just to hop back up there for a second, your options for health insurance do depend on things like your age. I mentioned Medicare. Your income is your big one, right? Your income determines whether or not you're going to be eligible, more than most cases, for your Medicaid programs. Your BadgerCare Plus, your Medicaid, your disability Medicaid, they're all going to look at your income. And whether or not you have health insurance from your job, that can determine, obviously, if you're losing health insurance from one job, you may have an offer through a spouse or a parent, and that might be the next step for you. And we'll look at that a little bit more closely in a bit here. Now, you might be a single person, and this could just be a pretty quick kind of mental math for you to figure out what the next best option is for you, what is actually available to you. Look at my income, look at my age. But it may be that you have a large family. Maybe you have a spouse with a chronic medical condition or a child with disability, and you know more about the state's health insurance programs than you'd even like to, because you've had to figure that out. And that's totally valid. And each person in your family may qualify for a different health insurance option. And navigators can help you look at all of those options and figure out just what your household should look like and be covered by. So the two big ones that navigators help with, I mentioned both of these already, BadgerCare Plus and the state of Wisconsin's Medicaid program. You can sign up at any time, and this includes more than just BadgerCare Plus. There are, obviously, I mentioned very briefly, disability programs, but these are going to be income-based. And as you have lost job-based income, if you lost one job and you've lost the income that provides you and your family, you may find that you're eligible for BadgerCare Plus or Medicaid, maybe for the first time ever. Also, disability programs. These programs have different income levels. And through the Department of Health Services website and through access.wisconsin.gov and different resources online, you can figure out what you might be eligible for. And again, you can always contact Covering Wisconsin, call our navigators, call our team, get in touch, and we'll be able to help you navigate these on an individual, confidential, one-on-one appointment basis. Healthcare.gov is the other big one that we do. It's the federal health insurance marketplace. So again, your ACA, your Obamacare, or like I said, we just call it the marketplace most of the time. Open enrollment runs from November 1st to January 15th, but we're more interested in special circumstances, right? If you lose your job-based coverage, if you've just lost your job and you're losing your health insurance at the end of the month, you have 60 days to get into healthcare.gov to get new coverage. So that's what we typically look for. Most special enrollment periods follow a loss of insurance. So sometimes you'll see things like if you move, if you have a birth or a death in the family, something like that. But the one we're interested in today is losing your job-based coverage, because that gives you 60 days to get into healthcare.gov and apply for new coverage. And the difference being, so BadgerCare Plus is going to be almost no cost if you qualify for it. In some cases, there are very small premiums and very small copays. Healthcare.gov is private insurance. So it'll work very similarly, if not the exact same, to what you have now. It might even be with some of the same companies. But you do have to pay the premium. Now, the cool thing about the marketplace, the way it's set up, is that if your income is lower, you get more financial help to offset those premiums. Those financial assistance is going to make that coverage affordable. So that's the first A in the Affordable Care Act, is they have financial assistance to make those plans affordable, so you can sign up and you don't have to go without health insurance. Now, COBRA, as you have, if you have lost your job-based coverage, this may be a word that you've heard a lot recently. COBRA being the continuation of your current employer health insurance. Now, a lot of times that means paying the full premium yourself. And if you've also lost your income, that might not make a lot of sense. So don't just take COBRA because it's there. Just because you don't really want to think about it, because odds are that's a lot more money than you need to be spending. If you've just lost your income, you should probably be looking at Medicaid and healthcare.gov. If you don't qualify for Medicaid, then you should still be able to get a lot of financial savings on healthcare.gov to pick a plan for you and your family that way. So, but there are some circumstances in which you would want to look at COBRA. First of all, if your employer is going to pay COBRA for several months, if they're going to keep paying those premiums even after the layoff or whatever the event is, that is always something to consider. You do have 60 days to choose to enroll in coverage, and that coverage can be backdated. It's one of the few circumstances, Medicaid being the other one, where you can choose to enroll after you find out you need it. And I can say this from personal experience. I have done this, where I have left one job, I didn't pick up COBRA, and in that 60 days, I fell on some ice and hit my head. So I did have to go to the emergency room, but I was able to elect COBRA even after that event happened and go back and pick it up. So if you have an offer of COBRA, it's one of the few times I would ever say that you are safe waiting. And I only reason, even with the knowledge I have as being the Navigator program manager, the only reason I feel especially confident is because I've done it. I've done it myself, right? So you can choose to wait. But that 60 days, remember, is going to be really important that you want to do something in that 60 days. Whether or not you're choosing to elect COBRA, you still want to remember 60 days as your special enrollment period for the marketplace. So you want to do something right away. 60 days being right away. I would do something right away to figure out your health insurance options. But it's really important to note, don't just take COBRA, because if you later decide it's too expensive, canceling your COBRA by itself is not a qualifying event to enroll in your spouse's coverage, or parent's coverage, or healthcare.gov outside of that open enrollment window that I mentioned. However, if your employer is paying for your COBRA premium and stops, so let's say, okay, we're going to pay everybody's premiums, but only for 3 months or 6 months. If they stop, that will get you another special enrollment period. So those are kind of the big factors on how to decide if you should take COBRA. Just knowing that most of the time it doesn't make a lot of financial sense to keep paying it. But there are also specific circumstances, like if you've used a lot of your coverage and you've already hit your maximum out of pocket, things like that, and you're going through the end of the year. But if it's early in the year, it probably doesn't make sense to stay on COBRA. So yeah, this, like I said, it's complicated, but that's what navigators are here for, to understand that. And everything I said, it's going to vary from person to person. So each of you watching this, your circumstances may be different, and it probably is a good idea to talk to an expert at some point. And then just remembering, this might be one of the easier transitions, but the special enrollment period time is the shortest. So I want you to pay attention to that here. So that you have health insurance from your spouse or your parent's employer. Maybe, your coverage was better, so you didn't have to use your spouse's coverage, or maybe you were on separate plans and it just made more sense that way. But when you lose your health insurance coverage, you can get a special enrollment period to get onto either your parents' or your spouse's coverage. Your parent coverage, if you're under the age of 26, so if they're, the younger folks amongst you, that might be an option. It may be one you're already using, in fact. But a lot more in these circumstances with rapid response, we see people hopping onto their spouse's coverage, which makes a lot of sense. But remember that you only have 30 days to decide to enroll in those cases, and coverage isn't going to backdate. So as soon as you know your coverage is ending, it's a good idea to get in touch with their payroll, their HR, their health insurance provider, and figure out what that transition should look like, and make sure that you have your plan and can avoid a gap in coverage if possible. But if a lot of times keeping in mind that individual plans are going to be a lot cheaper than family plans. So if that coverage is too expensive, make sure you look at healthcare.gov or call Covered Wisconsin, call us to learn more about your options. Because maybe individually it makes sense. Maybe they're only paying $90 for the premium, but if they add you as a spouse or add the whole family, it jumps up to $460, and that just doesn't make any sense. There's probably another option. So definitely keep our info in mind. We'll be looking at that very soon, and you can contact us and we'll happily help you navigate this whole process and answer all your questions. So there are other, and these are in quotes, options. There are short-term limited duration plans, which is The more complex the language, you can always tell that it's something you should be a little suspicious of. These are those plans that are meant to fill brief gaps in coverage or pay bills when you have out-of-pocket expenses. So, like in addition to health insurance coverage, but the term short term is really misleading because it can mean up to 364 days, which means these plans look a lot like insurance. They try to. They dress up like insurance, but they don't have the ACA protections involved. So things like pre-existing condition protections, things like emergency room care. They're not full health insurance, and that means people's claims can be denied. If again the company decides you have a pre-existing condition, something like that. So be very wary of these. These are the kind of things you're going to want to talk to a reputable agent about if you decide to get them. But most importantly, they don't replace health insurance, right? You shouldn't even be looking at these if you don't have your main health insurance figured out. It just doesn't make sense. The other thing is healthcare sharing ministries. These could be through an organization or religious affiliation. They can pay some bills, but just know that they don't have any of the protections of health insurance. When you're looking at health insurance, you want something that looks and feels like what you think health insurance means. That gut feeling you have, this should cover my medication, this should cover my emergency room, I should be able to go see my doctor. That's health insurance. So these other things, if they don't look or smell right, walk away and get in touch with the navigator, and we'll help you figure out what to do next. So just keeping those in mind, those plans we just talked about, there are people, these bad actors out there who will try to talk you into them anyway. There are a lot of bad actors outside of Wisconsin. So if you're suddenly finding that you're getting calls, or maybe it's open enrollment season for the year and you see all these ads online and you're getting emails and things like that, always be really wary of the people who are reaching out to you if you haven't done anything to make yourself known to them. Also, be really, really wary of websites you look for online. So when we're talking about the marketplace, that's healthcare.gov. So the tip at the bottom of your screen here, healthcare.gov, access.wisconsin.gov. That .gov is a big, it's a protector, right? This is a reputable site. This is the government. This is not just, Obamacare.com or something like that, where those people are waiting for people to enter their information and then just follow up. And then you're looking at agents from, again, outside of Wisconsin. I always tell people, if you can ask somebody where they're at and they don't give you a straight answer, or honestly, if anything like that, you ask any question that somebody should be able to answer and they just can't, hang up, right? Just hang up, walk away, call Covering Wisconsin, get yourself a navigator. But even more specifically, if maybe it seems right, but it might seem too good to be true and you just want to be sure, you can look up somebody's license number online, the Office of the Commissioner of Insurance website. That's that link right in the middle of the screen. And you want to make sure that nobody's steering you towards just one specific plan. So you want to say, hey, do you offer all, the plans in my area? Are you showing me everything I can see? And again, if you've got a bad actor, the last thing they want is somebody who's well informed, right? So they're going to hang up quickly if you start asking a lot of questions. But again, just watch out for those websites online. Protect yourself, protect your finances, and health insurance help, again, should always be free. Nobody should be charging you sign-up fees or maintenance fees or anything like that. You might have a premium you need to pay, but that doesn't mean that anybody should be charging you for just help getting your questions answered. So how to find an enrollment assistant, you can go right to our website. You can find our navigators, coveringwi.org/enroll. We also have a Spanish option there. Our organization, Covering Wisconsin phone numbers are on the screen. Our main line is the 608-261-1455. You can also call 211. You'll have heard a little bit about 211 during these presentations. And you could just dial 211 and say, I need help with health insurance. And they should be connecting you to either Covering Wisconsin or one of our subcontracts who also have navigators. You can go to our website, just a general, coveringwi.org/contact. There's our form fillable. So if you just have a general insurance question, or if you don't know you need to connect with somebody, you could fill that out. Even better than that, I would say, is that last option. There's our new chat option that was as new as it's still new to warrant the new, but we've had a lot of chances to refine and perfect it over the last 2 years, where you can just hop on our website and the little chat box pops up in the corner, like you're used to seeing on different things now, especially for like tech support. But ours is better because you're actually during business hours going to talk to our navigators. So the very same people you would have an appointment with, people like me, people like my staff, they are manning it, they're answering questions, and they're happy to help you figure out what your health insurance options are, or maybe you're not sure if you want or are ready for an appointment. They can answer some basic questions. Hey, I'm losing my job, losing my insurance at the end of the month, and I just want to know what to do next. Maybe you have some things figured out and you can provide some of that information and the answer is pretty easy. Or maybe they say, no, it does sound like you need an appointment and you just want that reassurance. Yes, I'm doing the right thing. So our chat feature is really, really good for that. So with that, I will conclude the presentation for today. Thank you all for your time. Again, Covering Wisconsin Navigators are here to help. Our help is free, completely objective. And if there's anything we can do for you, please let us know. Thanks so much.